Hello, everyone. Thank you for joining my presentation. My name is Emily Merchant, and I come from Rutgers University, Center for Agricultural Food Ecosystems. I study under Dr. Jim Simon. Today, I'm going to present to you my paper titled Barriers and Facilitators of African Indigenous Vegetable Preparation and Consumption, a Qualitative Exploration. Africa and Asia still share the burden for all forms of malnutrition. In 2015, 37% of the children under 5 in Africa were stunted, 25% were overweight, and 28% were wasted. We believe that African indigenous vegetables may offer a partial solution to these micronutrient deficiencies, which contribute to malnutrition. AIVs are high in micro and macronutrients as well as phytochemicals, and they can provide income generation to the farmers who grow them. Most of the individuals that we worked with in this study are smallholder farmers. And so, in addition to directly impacting household consumption through the nutrients that the vegetables provide, there is an unmet market that the farmers could sell their produce to increase household economics and household income, contributing to household dietary diversity in other ways. But focusing, for the sake of this talk, we're just going to focus on African indigenous vegetables from the lens of the nutrients that they directly benefit themselves. African indigenous vegetables significantly contribute to the recommended daily allowance for several different forms of micro and macronutrients. These are just two of many examples. And so in the table on the left, you see how in almost all cases, the AIVs contributed more than 75% of the RDA for iron. And in the table on the right, you see that in almost all cases, it was more than 20 to 25% for protein. And this is very significant contributions to daily nutrient intakes. When you're thinking about the barriers and facilitators for the consumption of African indigenous vegetables, one way to frame them is within the context of the food environment. So the food environment comprises of the promotion, affordability, availability, sustainable properties, and quality and convenience of the goods themselves. So in this context, right, we're talking about the AIVs. And then those factors influence the individual factors, which influence the diets. We further looked within the food environment and discerned between the external domain and the personal domain and the interactions that they have with each other. So on one hand, within the external domain, you have the availability or the presence of food, and then the accessibility. Can you physically get to it and purchase and acquire the goods? You have price. So what is the price within the market or the grocery store? And then the affordability. Do you have the purchasing power to buy those goods? And then these influence each other. As the price goes up, your affordability or your purchasing power may go down. As the price goes down, your purchasing power may go up. And then some of these are in relation to each other. The availability of a good could drive the price, which then drives the purchasing power. So in our study, we hope to uncover some of these nuances between these elements within the external and personal domain of the food environment. This study is part of a larger USAID funded research project titled Improving Nutrition with African Indigenous Vegetables in Kenya and Zambia. For this project, we used a market-first, science-driven approach. So objectives 1 and 2, or steps 1 and 2 of our research project, are part of that market-driven. We surveyed in Zambia and Kenya 500 households, completed a quantitative survey, and then we conducted a focus group, which you'll see in each country. And the focus group in Kenya had over 100 participants. And then we did an economic survey, which surveyed 300 producers and intermediaries. So that comprised our market first. Our science-driven part was verified performance and best practices. This was both in the lab and in the field in terms of genomics, phytochemical composition, anti-nutrient composition, as well as field performances. And then all of this information was packaged into recommendations and best practice and methods to be disseminated to both producers and households. In some contexts, those were the same, and in other contexts, those were different, depending on the community that we were speaking about. So our research objectives specific to looking at our research objective and goal for the entire project was to improve micronutrient status within vulnerable groups in Kenya and increase consumption of AIVs at the household level. And then our specific study aims for the focus groups were to document current practices relative to consumption and preparation, as well as identify barriers to and facilitators for AIV consumption and preparation. We conducted 14 focus groups, 7 male and 7 female, and you can see the specifics to those focus groups in that table there. We used in vivo to conduct the qualitative data analysis, and we calculated a Smith salience index on free list data, and that's the first thing we are going to look at. So for the free list data, men and women were asked what were their most preferred AIVs, and then the Smith Salience Index took those lists and the rankings and came up with the Smith's Index. So for women, we see that nightshade is the first most preferred, cowpea the second, spider plant the third. For men, these are still the same preferred, the top 3, but the ranking is a little bit different, where spider plant is number 1, nightshade is number 2, and cowpea is number 3. So overall, we see that African nightshade, spider plant, and cowpea are the 3 most preferred African indigenous vegetables within the communities that we interviewed. In terms of reported cooking methods, we have this table here to highlight all of our results as an overview. Each method that was reported by a focus group is represented here in this table. And so whether that's 1 through 4, like you see in nightshade, or just a bit bandwidth, like you see this boil for 30 to 50 minutes. So each one of these represents all of the data that we received. There's a lot going on here, and so I'm not going to read this all to you, but what I want to share is that although you expect to see some level of differences in methods, depending on the recipe that you're following, depending on the dish that you're cooking, of course, there's going to be different methods, but there's extreme differences in the same type of method, boil for 1 to 5 minutes, then fry, or boil for 1 to 2 hours and then fry, with extreme time differences. And these time differences were actually noted here as a barrier by some of the focus groups, saying the local vegetables take a long time to cook, and that discourages some people because they don't have that time to cook these vegetables. In addition to it being a barrier for preparation and subsequently consumption, we also know that as you cook vegetables, or it's been reported in other literature that as you cook vegetables for longer periods of time, some of the nutrients within those vegetables degrade. And so it could also render it as a less healthy dish. In the interviews, we saw tension between these shorter and longer cooking times based on the responses. And the shorter cooking times, according to the literature, are some of the cooking times that are being currently promoted as more nutritious. They're being what's incorporated into interventions, but the longer cooking times are what are historically and traditionally done. And so there's a tension between that old and that new methods. We came across 3 key barriers to consumption. The dry season itself was a very huge barrier: poor taste and monotony, and perceived negative health. The dry season affected both the availability and the affordability of the AIVs, as the dry season created a shortage, which increased demand and drove up price in the marketplace. Individuals also noted poor taste and monotony, both for themselves as the interviewee, as well as the family, and the family then contributing negatively to what the women are preparing for their family. And then perceived health. So it was noted by some of the focus group discussions that either the AIVs caused or exacerbated pre-existing health conditions such as ulcers or skin rashes. We also noted key facilitators, 3 of them, that actually seem to be the other side of the coin to those barriers, where when AIVs were in season, they were very affordable, more affordable than Western crops. They were easy to grow. You could find them in the wild, or there were garden volunteers. And this helped save money at the household level. Some women also reported that the AIVs were very easy to cook. They were simple ingredients. They contributed to a well-rounded meal. And if they weren't causing health conditions, negative health impacts, individuals noted that the AIVs were known to be a source of healthy food. Based on this information, we recommended that the interventions be focused at improving household production to increase affordability and availability. So working with the producers to allocate some of their land just for household consumption to ensure that their household had enough AIVs to meet their household demand. Intervention also recommended to work on improved cooking methods and recipes, so methods that made sure that the nutrition quality of the dish remained as intact as possible, as well as recipes to make it more interesting, a little bit more variety. We also noted that it was important to teach the households what to do with the dried vegetables. And a lot of the production and post-harvest training incorporates solar drying or sun drying the AIVs to save them when they're in plenty for when they're not in plenty for during the dry season. And during some of our interviews, we noted that you would ask the women, were you trained in drying your AIVs? And they'd say yes. And you'd ask them what they did with their dried AIVs. And they'd point to a bag of dried AIVs in the corner and say, I don't know what to do with them. I wasn't trained on what to do with them. So it's important in order to create your long availability and access that the women preserve vegetables when they're in plenty and then are taught what to do with them for that time. We also think that the promotion of the health benefits of AIVs should be at the forefront of all of the work that we do. So with that in mind, the intervention aims of our project focused on recipe evaluation and reinvention with the communities. We worked on tweaking some of the recipes to make them a little bit more exciting, incorporating different types of spices or working with different spices so that, maybe you cooked kale a couple nights in a row, but each night you cooked it a little bit different with a little bit different flavor to make it a little bit more interesting. And then evaluating these recipes for nutritional quality. We then also conducted a culinary training at the community level, and we worked with producers to improve the seasonal availability of AIVs and access. I would like to thank USAID for their funding, which made this research project possible. I'd also like to thank all of my co-authors who come from Rutgers University, CalRO, and AMPATH. And thank you to you for listening to my presentation. Please let me know if you have any questions. Bye.